because we have been surprised. And maybe the reason we've been surprised is because we didn't map this out perfectly in the past. So we go throughout a very large section of your spine, and we see what parts are more tender and what parts are stiffer. And we work those parts, and then we see how it changes your symptoms. And if it does, then we know we had the right area, and we actually had where it was coming from. So in the nerve signal goes to your elbow, and it tells your elbow how it's doing. It tells your elbow how strong to contract, how quickly to release, how much to relax. It tells your elbow if it's being stretched or pulled, if it's hot or cold, if it's in pain, if it's numb. That signal plays basically like a vital role in how well your elbow is doing. And if that signal gets dampened at all, you're going to see changes. You're going to see stiffness. You're going to see that muscle not turn on as quickly as you need to when you're throwing a ball. And that muscle needed to turn on in order to protect your elbow, and now it's turning on a split second too late, over and over and over and over again. And then you can kind of imagine that would lead to an injury. And it would lead to an injury, but that injury would be at your elbow. It wouldn't be at your nerve. Your nerve was already damaged. That signal was already not getting there as quickly as it should be. And because of that, something failed down the line. But because it failed down the line, down the kinetic chain, that's where it hurts. So that's where we look at.
So let me go back to your Netflix example. So what you're saying is, I have constant lag on Netflix, but I don't notice it because it's just one of those things.
Because you still have enough
correct,
broadband.
I'm still seeing it. I'm just not seeing it in full definition. And then all of a sudden it stops and I go, what's wrong with Netflix?
Yep.
Well, there's nothing wrong with Netflix. It was your internet the entire time.
Sure.
Right?
Yeah, you could call up Netflix, but
right, like whatever, Amazon, whatever. But if your elbow is Netflix, you don't notice it until Netflix stops working, and then everybody blames Netflix. Nobody looks at the internet.
Yeah, and you can kind of use it like now we're 8K ultra definition, right? Well, if it went to 4K, are you going to notice a difference, right? If it went to 1080p, are you going to notice a difference? Probably not, right? But if it goes to dial-up, you're going to notice a difference.
So this brings up an interesting thing because professional athletes, right? They're the 8K of their sport is what it boils down to. If you take someone like, I don't know, Tom Brady, and his release is off 0.1 second.
And then he's not Tom Brady anymore.
Right. It changes the entire trajectory of his throw, his ball, his timing. Because like 0.1 second doesn't sound like a lot, but if you have a 0.7 second release, 0.1 second is a lot.
Is a lot.
But then
1/7, right?
And then if he starts getting pain in the elbow, everybody by default will go, oh, there's something wrong with his elbow.
Right. And they'll treat it and they'll see if it gets better. And often it will, because they'll give it the appropriate rest. They will strengthen it, which will help. But again, like, you're strengthening a muscle that's weak, but the muscle's not weak because Tom Brady's not weak, right? Tom Brady's lifting every day. He's playing professional football. So why all of a sudden did his elbow become weak? It didn't. The signal wasn't getting there. The muscle's not turning on, and that's why it's weak. So you can strengthen that, and you might even see some gains. You might even see some improvement. You might even see some strength gains, and it'll feel better if you rest it. But then when you go back to use it, the problem's still going to be there. And I can guarantee that athletes are going to listen to parts of this and they're going to say, yeah, that makes sense because I went through this myself. I was a pitcher. Baseball was my entire life. And I had shoulder pain since I was a real young kid. And I was always pretty good at baseball. And every season, especially when we got into like my junior, senior year of high school and my freshman year of college, was the exact same. I would start out and I was just throwing great. The ball was crisp. It would move. It went where I wanted it to go. And I was doing really well. But then within a short period of time, as the season progressed and it kept getting less and less, or quicker and quicker, all of a sudden I'd spike the ball into the dirt. My ball wouldn't go nearly as fast. It wouldn't be as crisp. And if I was playing catch with somebody that was only, 45 feet away from me, which is real close, I couldn't guarantee I was going to hit them. I start looking at mechanics. I start doing more rotator cuff strengthening. I start changing my pitching style. And you start thinking, all right, well, maybe I just suck, because in the moment, you don't think rationally. You don't think, well, I was doing good a little bit ago, but baseball is a very mental game already. So that, you start thinking, maybe I peaked out. Maybe I'm in a funk or a rut. And it wasn't that at all. It's the fact that that nerve was getting more and more damaged. The muscle was turning on less and less strong. and I was fatiguing more and more quickly, and it kept being shown early and early at the beginning of the season. It got to the point where when I was a freshman in college, again, did really well. First like few games, and then I couldn't even make it into halfway into the season. And exactly what I said, the ball wouldn't move as quick. It wouldn't go where I wanted it to. And like Donovan McNabb, I'd spike it into the dirt once in a while for no reason. And I bet you Donovan McNabb, by the way, it was your neck.
Oh yeah, looking
back, yeah, a little too late now. But I mean, Peyton Manning ended up having neck surgery. Yeah. Ben Roethlisberger had an elbow injury for a while that nobody was figuring out, and I wanted to like shout at the screen like, "Hey, it's your neck. We can fix this." But he wasn't on my fantasy football team, so I didn't really care.
Okay, good.
Yeah. So if he was on my fantasy football team,
you would have made the call.
I would have made a bigger effort,
okay.
Right?
So you're going to get the detractors, right? They're going to say, well, this is all anecdotal evidence.
Yeah.
Right? Like you're going to run into that. And it's not, let's just be clear. You're not calling for, oh, this should be the first treatment that everybody seeks out, or
no,
you're just getting back to the, well, it should be one of the points of elimination. Right?
I basically put it needs to be another box that gets checked off before you go down the rabbit hole of injections and God forbid surgery. Before you spend a whole bunch of time wasted sticking to the elbow, somebody should just take a quick look at your neck. We can do it often in a visit. One visit, an hour visit, I can look at you, I can listen to your story, I can look at that body part, I can check that corresponding area of your spine, and I can let you know, and I can probably even show you if it is a problem and we work on it, we expect you to get better. And we expect you to see improvement that visit, significant improvement, right? Like if it was an 8 out of 10 pain, we wanted to see maybe go to like a 4 or a 2, or I mean, even a 0. If you had limited range of motion, we want to see that improve quite a bit. And often that's the case. We want to see it that session. So the point is, I can spend an hour and I can tell you with a relatively certainty how much of it, or any, is coming from your spine. And then we can move on, and now we didn't waste months, months, years treating your elbow, seeking treatments for your elbow, getting surgery for your elbow, injections for your elbow, medication that you're taking orally, or slapping a patch on for your elbow. And you basically, whatever improvements you saw probably weren't as good as they should have been, and we could have just treated your spine and gotten you back a lot quicker.
So what's the downside to having this as a checkbox, as a method?
Nobody knows about it. That's the downside. Nobody knows about it. And the people that do, there is a small subgroup of people that do this, that already do this at an orthopedic standpoint. They're called McKenzie physical therapists. Both of us have a specialty in the field of McKenzie physical therapy. Robin McKenzie was this physical therapy guru, I think in like the 40s to 70s, somewhere around that time frame. I'm bad with dates. And he started all this. He started this. He noticed, and it was actually by mistake that he noticed this. But if you go to a McKenzie physical therapist and you say my shoulder hurts, they will map out your shoulder and then they will look at your neck. But they're not. I don't want to shit on the McKenzie therapists, because I think they're actually one of the best in our field. But they're not good at manual therapy. They don't work on the spine nearly as much. Like one of their approaches is to not touch the patient if they don't have to.
So once again, if we go back to the check boxes and too much hyper-focused, have they just fallen into the same trap as everyone else, where they now assume 100% of the time the spine is the issue? No,
and actually almost in the opposite. They'll check your spine, but then they'll give up a little too quickly, and they don't necessarily look at it as well as we do. Not to tout ourselves, but again, like they have, when you go to a McKenzie course, the first course I ever went to, the instructor goes, this isn't a tool in your toolbox, it's the toolbox. And you're like, no, like it's something, and it works, and it worked better than anything else that I had come across to that point. And I already had 2 specialty orthopedic certifications beyond my doctorate. So, and the only reason I did McKenzie was because I was starting my own business, and McKenzie is more well known by the doctors than anything else in our field. So I only did it because I wanted to be able to market my business better. I mean, I wanted to become a better clinician, but when I was in school, when I was doing my orthopedic specialty, when I was doing my Maitland specialty, which is the mobilizations and stuff, all of those places really downplayed and like kind of crapped on McKenzie. So I went into it thinking it wasn't going to really do anything. And when I took the course, and you had to take a few courses and then take a test, it worked better, more concisely than anything else that I had been taught. So then we started running with it. Then we took it and we stared running with it. And all of a sudden, it got to the point where we felt like we were doing it better and exploring it better than the instructors than the people that were instructing us. And not only that, they apply it just to the orthopedic side of it. You know, your shoulder, your elbow, your wrist, your hip, knee, your foot and ankle, or your spine itself. We've actually found that we can apply it for your less common symptoms that you would go to specifically for a physical therapist for, like, again, asthma, Crohn's, acid reflux, all these more like nebulous conditions that nobody really knows why is there, and they have a whole bunch of different theories. Like if you go to somebody and you say, I have acid reflux, somebody will say, well, you need to take this medication, or you need to avoid these foods, or you need to sleep in this position, or you need to take probiotics for your stomach. They have all these things that they could do because nobody really knows why it's there in the first place. But I would imagine that if you looked and you said, like, okay, whatever controls the acid in my stomach, either too much of it or too little of it, that has a nerve connection. So do you know what it is? And this is where we're bad.
I don't.
Let's say it's your gallbladder, pancreas, or whatever that is functioning either too much or too little. And the only thing that you could do right now would be to take medication in order to change that, in order to help it out. But the way we look at the body is that we would look to see if we could change that signal, that internet signal that's getting to your gallbladder or your pancreas, and change it, and then see what effects that would have. And we did that with a patient that had Crohn's, and she was cured in 5 weeks. She had Crohn's for 9 years, and we'll get into this later. But she was cured within 5 weeks, and all we did was treat her back.
So are you redefining what a treatment should look like?
We're redefining the way you should be evaluated, at the very least, and then the application of that treatment. And that's what we want. We want it to be, and it shouldn't make sense to a lot of people because the way our medical system is right now, it's not great. And I think that should resonate with a lot of people that are listening or reading this. You know that you go to your doctor and they give you some stuff and it kind of helps or it kind of doesn't. And then they try something different. And really all they have to offer is medication. Medication and injections are basically what they have to offer, or they tell you to go to a physical therapist. And we already talked that the physical therapist is going to stretch you and strengthen you at that specific area, or it's surgery. And that's about it. They don't have another way of looking at the body, and that's what we want to do. We want to say that there's another way, which we think is much better, and it needs to be adopted throughout most, if not all, aspects of healthcare. And we need to search it. We need to look into this more. We need your GI doctors saying, hey, your symptoms don't fit this inflammatory condition. We didn't find all these inflammatory markers in your body. Your symptoms seem like IBS or Crohn's or Gerd or whatever, but we're not really finding the telltale sign. So let's have your spine looked at. Let's have somebody take a look at your spine and see if they can find something, and we'll try that first before we put you on heavy dose steroids and lifelong medication that has other side effects that are vast and include death.
Yeah.
So you're really just advocating for additional evaluation rather than a de facto, oh, here's the symptoms, it must be this.
Yeah, a different evaluation and different treatment, but I also want to change the physical therapy world too. The way it exists right now, it's not as effective as it should be, and I want to change that additionally.
So I just want to be clear, because there's going to be people that jump to, well, it's an all or nothing. You're not saying that conditions like these don't exist. You're just saying there could be an alternate way to treat them.
Yeah, and one of the biggest cases that we'll talk about is it. And so yes, these conditions out there absolutely exist, and they need to be looked at by your doctor. Typically first, they need to rule out something more nefarious. They need to rule out an underlying heart condition or high blood pressure or something that could be life-threatening. Absolutely need to rule that out. But then once they've ruled that out, before you do anything else, you need your spine ruled out.